blood transfusions save and improve lives every day, and they rely on one key factor to be safe and effective: communication. Communication takes place with patients and families, other members of the team, and with clinical and laboratory teams. This can occur within the same hospital and between hospitals involved in patient care. Handovers among healthcare professionals must ensure accurate, reliable communication of task-relevant information to ensure continuity of safe and effective working. When there is a communication issue, there is a risk to safety. Safe and effective communication in healthcare is critical for improving patient outcomes, reducing errors, and enhancing collaboration among healthcare professionals. Let's see an example. A patient experienced unexpected major bleeding the day after routine surgery, resulting in the activation of the major hemorrhage protocol. They were hemodynamically unstable with a pre-transfusion hemoglobin of 36 grams per litre. There was a 15-minute delay in the issuing of red cells because the laboratory staff were unclear about the patient location following transfer from the intensive care unit to theatre. There were several communication issues during the major hemorrhage protocol, compounded by a lack of clarity among staff who were unfamiliar with it. These communication issues resulted in delayed transfusion to the patient. This case highlights that communication issues can lead to avoidable adverse consequences, such as incorrect blood components being transfused or delays occurring in urgent care. Every year, communication issues are commonly cited in several incidents reported to SHOT. From reports analysed in 2023, communication issues were cited as a contributory factor in 24% of laboratory errors. Communication issues were a factor in 68% of reports of delays during massive hemorrhage situations. A breakdown in communication was implicated in nearly 50% of reports of wrong component transfused and specific requirements not met. Learning from these incidents and improving practices is essential to enhance safety. Understanding barriers to effective communication and employing methods to overcome them ensures that patients receive the safe transfusion care and support they need. Reporting incidents and reflecting on practice helps to support continuous improvement. Unreliable communications in healthcare can result from a variety of problems, such as missing, unnecessary, or inaccurate information, communication which is of poor or variable quality, failing to carry forward information over successive shifts, and general misunderstandings. Poor communication can be compounded or hindered by other challenges and factors, and these include poor communication methods, staff feeling under pressure, lack of assertiveness, complacency, lack of resources, stress, lack of knowledge, fatigue, lack of awareness, distraction, lack of teamwork, and existing culture. Cognitive biases are increasingly identified as contributory to errors in healthcare. These biases are mental shortcuts that speed up our ability to make judgments. The assumptions we make can distort thinking, influence beliefs, and sway our decisions and judgments. We might make assumptions or focus on information that supports our beliefs, leading to missed details. Consider this case, which highlights cognitive bias. A unit of red cells was delivered to the ward, which was short-staffed and busy. Nurse A knows that the patient details and compatibility checks have been done correctly in the laboratory, so does not recheck them before administering the unit to the patient. Nurse A intends to check this is correct procedure with Nurse B, who is more senior, but due to workload pressures does not want to disturb Nurse B, who is also coordinating the ward. In this case, there was an assumption bias that the unit of red cells was checked by the laboratory, so must be right and do not need verifying. There were also contributory factors which may have impacted communication opportunities between staff. Heavy workloads and hierarchical structures can hinder open dialogue, making staff reluctant to speak up or ask questions. Recognizing these factors is crucial for improving workplace communication. Clear and accurate communication between healthcare professionals is critical for ensuring that blood transfusions are given safely. From identifying the right blood type to verifying patient details, every step needs to be carefully communicated. The professional standards that govern and guide practice emphasize the importance of effective communication to reduce the risk of errors. Effective communication also means ensuring the message is understood. The 7 C's of effective communication are principles for ensuring clarity and understanding in all communications in healthcare settings. Let's look at them now. Clear. Messaging should be straightforward and easy to understand. Avoid jargon and focus on the core points. Concise. Communication should be kept brief and to the point. Avoid unnecessary words and repetition to maintain the listener's attention. Concrete. Specific details and solid facts will support your message. This helps ensure that the information is understood. Correct. Information should be accurate and free from errors, including grammar and spelling. Coherent. Messages should be logical and well organized, allowing flow naturally and be easy for the recipient to follow. Complete. All necessary information should be provided so that the recipient has everything needed to understand and act. Courteous. Politeness and respectfulness, considering the recipient's perspective, will help to foster a positive communication environment. These principles apply to all forms of communications, including verbal, nonverbal, and written. When communication is clear and accurate, it leads to safer transfusions, fewer delays, and improved outcomes for patients. Everyone knows what to expect, and the risk of errors is significantly reduced. What makes communication effective in healthcare? Psychological safety. When staff feel safe to speak up, question decisions, and share concerns without fear of judgment or retribution, they actively contribute to patient safety. Open dialogue ensures that potential risks are identified and addressed early. The role of leadership. Leaders set the tone for communication. By modelling transparency, approachability, and openness, they encourage a culture where everyone, from frontline workers to specialists, can voice concerns freely and contribute to decision-making. Clear guidance and staff training. Staff need to be trained appropriately to communicate effectively with clear guidance on what is to be communicated, when, and who to. Application of human factors and ergonomics principles, ensuring optimal facilities, environment, and time that enable good communication is essential. By optimizing systems to account for human limitations, we reduce errors and increase teamwork, ensuring patient care is both safe and effective. The importance of the patient's voice. Listening to patients is incredibly important, as they bring unique insights that help ensure treatments not only work well, but also fit into their everyday lives. When providers pay attention to what patients have to say, it leads to better decisions and care experiences. Well-informed patients make better choices and have better outcomes. The role of active listening. Teams should listen actively, repeat back, and confirm key details before moving forward. Empathy, patience, and cultural awareness can all help to build rapport. What are some strategies to enhance communication? Using technology. The use of technology to support safe, timely, and effective communications in healthcare is rising and must be considered. These may include assistive devices and services such as hearing aids, communication apps, interpretation and language line, bedside communication tools, and patient portals. Information technology systems including telemedicine platforms, whiteboards and electronic patient records. Implementing frameworks and tools. Several frameworks and tools are available to support safe and effective communication in healthcare. Some examples include SBAR, which is Situation, Background, Assessment, and Recommendation, is an easy-to-remember, concrete communication mechanism for framing any conversation or transfer of information. Closed-loop communication is a technique to avoid misunderstandings in verbal exchanges. Safety huddles are short, multidisciplinary briefings held at a predictable time and place. Team briefings may take place to brief practices to enhance safety, for example prior to surgery. Debriefs may occur after an event to discuss its outcome and seek to engage teams and staff who may be affected. Hot debriefs take place there and then. Cold debriefs may take place days or weeks afterwards. Effective communication is the cornerstone of quality healthcare and safer transfusions. Good communication helps to maintain situation awareness. Effective communication during shift handover is vital to ensure continuous, timely, and appropriate care for patients. By ensuring clear, consistent, and complete information sharing, we protect patients and provide the best possible care.